uh, it takes sponsorship, and we're thankful for all our sponsors. And the sponsorships that really thrive are Intel, Accenture, a number of others, and we couldn't do it without their support. And I want to really share the fact that 3D printing has been around for a while, and it's a proven commodity. Like Hussein could share, from TechWorks and now for 3D Media. Hopefully you'll get involved in the conversation and share your thoughts. But it's a proven commodity, and I think that's what we want to highlight today in terms of hearing aids and also lower limb and other opportunities. And feel free to dive into the Q&A. And also, I think we want to share this sense of urgency. Today with Gaza, today is the day. Let's seize the moment. And I think that's why I'm excited to have these panelists, because they all have different perspectives. And Dr. AbdelRahman, he came yesterday from the West Bank. And so that's a commitment. And I just want to say thank you for coming on behalf of PCRF. And I think lastly, before we jump in, I think our hearts are really to do a pilot. We just got a 3D printer on the ground a couple of weeks ago, after 8 months of advocating and getting our approvals. So just exhilarating. And we really want to put that to use. But we know we need implementing partners on the ground in Gaza. And so part of our heart is just to really hear from people that have the expertise like yourselves and say, how do we come alongside and add value as a small player? And so with that, I'm going to take a moment and really just give a chance for all of the speakers to introduce themselves. And if you want to go to the next slide, Josiah, these are all speakers in there. We have some speakers online, which you can see from Heal Palestine. Dr. Shehan, we invited Dr. Ghassan Abu-Sitteh, but he couldn't make it. But he told us that Dr. Shehan would be the best replacement for him. And we're excited to have his voice from Imperial College in London. And then also we have Tony from Bionic P&O. They've been doing 3D printing prosthetics for a while in the US. And so we're just rinsing and repeating off of their success. So with that, I'm going to pass the mic so you all can begin. Ladies first. So,
thank you, Jason. My name is Ons Alkhadra, and I work with International Medical Corps. I manage the relationship with the Middle East and the Gulf and donors. International Medical Corps is a U.S.-based nonprofit organization. We are a medical relief organization that's been operating this year. We're celebrating our 50th year. We're known as the first responder to any emergency. We've been working in Jordan since 2006, and we've been providing medical care, mental health, and protection to vulnerable Jordanian and Syrian refugees, and before that, Iraqi refugees. Since I'm not going to talk about Gaza. My name is Entesar. I am a CEO and business development manager at Mafaz for medical. Mafaz for medical is one of the leader companies working in prosthetics, manufacturing prosthetics components at Ottobock. Maybe it's known for many of you. So we are the company that still are delivering this prosthetics in Jordan. We are working in Jordan since more than 18 years. Working with many sectors like Royal Medical Service, OIH, and many other NGOs. So our mission always to bring people to life again, to let people start life again and new. This is our mission. So me also, I'm going to talk about Gaza now. I will leave it to
my name is Dr. AbdelRahman Marridi. I'm from Ramallah, Palestine. I am here representing Palestine Children Relief Fund. It is one of the oldest organizations, NGOs working in Palestine, established in 1991. It started with helping pregnant children for treatment abroad, but it has expanded much more than that during the last 20 years. It is now on the ground. We have 50 staff in Gaza at the moment. We have sent 2 medical missions recently to Gaza, and in the 8 months of the war, we have managed to ship $27 million worth of equipment and food and nutrition into Gaza. Previously, before the war, we had many programs inside the West Bank and Gaza involving building local capacities in hospitals and in clinics. And we have been helping treating children everywhere. I am head of the orthopedic committee of the medical advisory board of PCRF, and I've been responsible for organizing the limb-saving problems in terms of medical treatment, surgery, and later on, we can fix the problem with prosthetics. Besides, do you mind if we go live with the other speakers so they can introduce themselves as well?
So my name's Steve Sosebee. I am the founder of PCRF. Dr. Marridi, thank you for introducing the organization. I founded. I appreciate that. Built the organization for 30 years. On January, we started Heal Palestine. We've been very actively involved. Back in 2018, we founded a project on the ground in Gaza for amputees, and we're building and working on training at Hamad Hospital, local doctors and technicians in developing good prosthetic care, particularly above limb, artificial limbs. Heal Palestine has a field hospital on the ground. We've been treating and have several amputees outside getting medical care and getting medical treatment. Given the situation on the ground in Gaza, obviously these patients cannot be treated. We have a huge health advisory board of limb specialists, salvage specialists, and also prosthetic specialists who are helping to develop a prosthetic program on the ground in Gaza. We're in the process of developing that program and building it with local stakeholders, and are excited about any opportunity that can develop a long-term plan for addressing the thousands of children in Gaza who are suffering from traumatic amputations. And also, obviously, there's kids with congenital issues that need to have amputations as well. So we're keen on supporting these patients on the long term, not only for their immediate needs to get them mobile and independent, but also for the long-term support that they'll need for continuous replacement and repairs of their limbs. And we hope to partner with anybody who wants to be a part of that.
Hi, so I'm Shehan Hettiaratchy. I'm a plastic and reconstructive surgeon based in London, UK, and I spent the last 25 years or so working both with UK military and UK NGOs in various different war zones. And we've also had a long-term collaboration. I'm here at Imperial College with American University Beirut, working with Hassan Abusita and the team there with projects into Gaza. And also work with UK Med, and UK Med have got teams on the ground in Gaza at the moment. And I was off there in January, February this year. So we're also really focused around limb reconstruction, both from a clinical perspective, but also the academic and research and development perspective from Imperial. Thank you.
Okay, great. My name is Tony Gutierrez. I'm the National Clinical Specialist for Advanced Prosthetic Solutions with our company, Bionic Prosthetics and Orthotics Group. We have 50 clinics across the U.S., and we are one of the leaders across the United States in implementing FDM, or filament-driven 3D printing, into our prosthetic care. I'm decided it would be a great show to do a presentation from our 3D printing lab here in the clinic. We've been really dedicated over the past 7 years to building this program to support our practice and enable better patient care, faster patient care. And we're really thankful to have some strong partnerships with multiple local universities and the Department of Defense, as well as Filament Innovations, who manufactures these printers, and Mitsubishi Chemical, who's a big manufacturer of the filament we use, to be able to continue to push the boundaries of what we can do in this space. And we're really focused on some research studies with the Department of Defense to show effectiveness of 3D printing for long-term prosthetic care. And I think this is a a great mission and a great opportunity to support these young kids in need with a reliable and low cost, effective solution to help them regain their mobility.
I just want to go to the question, and just so you guys know, we're going to ask a question to the panel, and then we're going to come back to the audience with the same question. You guys will have a chance to interact, just like they've shared. So the first question is around, the challenges of attendance.
Dr. Shehan, do you want to throw in your 2 cents here on short-term, medium-term solutions?
Thanks. We missed some of that, I'm afraid, because our comms aren't great. But I think I was catching short term, but the challenge of having residual limbs that are suboptimal, and I totally agree with that. I think there's also going to be a problem with limbs that perhaps try to be salvaged, or people have have not amputated, which may require amputation to get good functional outcomes. So clearly that's going to be a problem. And I think we're all aware of the real challenge as well of delivering that kind of surgical part of getting a good residual limbs is the scaling of how do we get that expertise in, how do we scale that so we can match the surgical support to the huge demand that's there. So I think those are the kind of immediate challenges. A longer term, I think we're all conscious of the fact that scale is probably the biggest thing, as well as the challenges specifically around Gaza with materials. So again, how do we get effective scaled, effective prosthetics for this large volume? So nothing particularly, unsurprisingly, I would think. But I think there's as you say, your analogy of the rice and tide, definitely a lot of people from a lot of different organizations from lots of different countries who are focused on this. And I think the real art here is to get that unified collaboration to maximize and optimize our interventions at both immediately, medium term, and long term.
Oh, that's wonderful. Thank you for sharing, Doctor. I appreciate it. Steve, you have any thoughts here? And then I'm going to pass it. I want to give Ons a chance to share too from the IMC's thoughts from Gaza. Go ahead, Steve.
Thank you. I mean, I think I appreciate everybody's input, and I think there's a couple of points here that I'd like to raise. One is that obviously none of us know how Gaza is going to develop or even be permitted to rebuild, and when that is and how that's going to look, who's going to be responsible for it. Will the North be permitted to have the same opportunity to rebuild as we were able to provide services there before? Hamad Hospital before was one of the main centers for prosthetic limbs prior. Now that hospital has suffered significant damage, has not obviously been utilized since October. And will there be the ability to rebuild services there? If not, where will that center of services be? All of this makes it very hard to have significant or detailed planning in place because we don't know what Gaza is going to look like. Obviously, we've heard from the Israeli Ministry of Defense that they are planning to continue this offensive until the end of the year. So therefore, it makes it very difficult to actually have any real impact on the ground in Gaza to provide artificial limbs and training and support for those who are in need. The other thing I'd like to stress is how important it is, dealing with the kids that we have now being treated with significant amputations and those that are coming out that we're placing in hospitals for artificial limbs and for surgery, limb revision, stump revision, and then artificial limbs to be built for them. It is how important it is to integrate that into other services, not just from a surgical point of view, but all of these kids are highly traumatized. All of these kids are suffering from significant mental health issues. Obviously, it's completely understandable. The entire population of Gaza has been traumatized, and therefore, any kind of plan that is going to take into consideration the need for them to become mobile and independent through the kind of services we're talking about today, which are absolutely essential, should also involve mental health support. If kids are not able to, be motivated to do the therapy and to go through the process of treatment, which is long and in many cases very difficult. We're seeing a lot of really high limb above knee amputations on these kids, which require huge amounts of rehabilitation and difficult and painful therapy. the mental health component is absolutely essential. And what we're doing is integrating that in our program as well. All of the kids that we treat do go through extensive mental health care and support. We also have a team on the ground in Gaza who are doing extensive mental health care for patients as well. So I think that needs to be discussed always. It may not be the main important point of what we're talking about today, but it certainly needs to be integrated into any program which is going to be built around treating kids for the long term.
Thank you, Steve. That was well said. I'm going to give Ons a chance to share from your perspective for Gaza, short-term, medium-term solutions, prosthetics.
So talking about Gaza, we've been working Gaza since 2008. I did not give the background about our work. In December, we brought in our first field hospital, and it opened its doors in early January. By now, we have 2 field hospitals, and we were quite criticized at the beginning for bringing a field hospital, but it proved to be the right thing to do. And I'm glad to hear that other organizations have done that as well, because it gives us the ability to move the hospital to make it more accessible to people as the dynamic changes from 1 month to another, from 1 week to another. So far, we've moved our hospital at least twice. We had to expand it significantly. Now we have over 200 beds. We provide mainly trauma care and obstetric. We do support malnutrition, and we provide mental health support. Short-term solution for prosthetics, I don't see it. Unfortunately, I'm a bit skeptical on ability to do anything short-term. Long-term, once static hospitals, MOH hospitals are back and functioning, that's what they need. Patients with prosthetic, as all our orthopedic physicians here know, they need several appointments, several visits to fit the prosthetics, to get the measurement, to fit the prosthetics, and then later on to do their necessary physical therapy. With people on the move, some people have moved 4 or 5 times so far within the strip, and they're moving again. They cannot have reliable place to go and see the physician over and over. So they need MOH hospital to be functioning again, so they can have those reliable appointments to get what they need to get. One of the biggest challenges that was not brought up.
We'll go to challenges next, so just hold off on challenges.
Okay.
That's the next question. So, but thank you for answering that. That's good. I want to go back to the audience. Thank you guys for sharing. I think, Steve, you mentioned the psychosocial, and I think this is critical. We have a couple people in the room that focus on that. So I'd love to hear from you. But I want to know from you guys, and when you have a question, I need you to come up here and just share it in front of everyone. So, or an idea, short, medium-term solutions for prosthetic care in Gaza. If you have any thoughts, come up and share. This is your time to shine. If you have anything, Cynthia, feel free. Anyone, if you have any thoughts or ideas. Go ahead. Come on up, Hannah. Hannah from the King Hussein Foundation. Come on up. Yeah. It's just for the live stream. It's easier if people can see you. Thank you very much.
Well, thank you for the introduction, although it's very saddening and very heartfelt to hear the very sad news. And somehow I do agree with you, but I don't want to be so negative. What I would suggest that, as you said in the very beginning, and everybody mentioned, is that we definitely need to do emergency hospitals. They don't have to be static. They don't have to wait for the MOH, because we all know that MOH will take a long, long time with all the restrictions on the resources coming in. So I think collectively, what we should focus on is doing the great job that you are doing, having, temporary hospitals set up, and I love the idea of mobility of those hospitals because this is a sad situation and it will prolong. And I think that's the best way. Thank you.
Thank you, Hannah. Thanks a lot.
Thank you.
So the reason I'm a bit negative, it just with prosthetics, you need to have that sustainability. And I agree with you, we need more hospitals. Like kudos to PCRF and Heal Palestine and all the organizations that are there. I think Mid-UK is there, but we need way more, way more. We're barely able to catch up with the number of patients, and I think everybody agrees to that.
I just want to add one comment. I think the situation before the war was that many of the patients in Gaza used to travel to the West Bank and Jerusalem for treatment. I know at the moment this maybe seem far-fetched that we can shift patients, but we have the capacity in the West Bank to take care of a lot of patients. The hospitals of MOH and the private sector and the NGOs are there. We also have the capacity to fabricate the the prosthetics. There are 9 workshops and 1 factory actually in the West Bank. I know it's more of a logistical challenge to do that, but the West Bank is the closest thing to the Gaza. From border to border, it's 1-hour drive. So I know at the moment doesn't seem to be happening anytime soon, but it is one of the solutions in my opinion, because we have the capacity to do a lot of work if we can do that.
Thank you, Dr. Abdullah. And anybody else from the audience, any thoughts here, short term, medium term, or we'll go back to the panelists. All right, we'll go back to panelists. Anybody else? Let's go to the next question maybe, because I think we hit on that. Let's go to overcoming challenges. You know, what are the challenges that we need to overcome in the reality of the solution in the near term, medium term? Like, what are the challenges that we face? If you can share clearly. And I think on this, I think we'll hit everyone, but maybe we can start with Steve again, and then go to Dr. Shehan.
Thank you. I think I mentioned a little bit the obvious challenges, the reality on the ground in Gaza right now, just having access, getting equipment in, getting materials in, developing and supporting an institution that can provide direct support and care for patients, even to the field hospitals. At the moment, this is not really an option given the huge restrictions. And now that the border has shifted from Rafah over to the Jordanian-Israeli access point, it's even more restrictive on what is able to get in, particularly by visiting missions. They're highly restrictive now. So even bringing in parts, let alone actually complete kits for prosthetics and even the printing materials at this time is not possible. So I think that the main restriction is right now, the main challenge right now is just the limitation on getting supplies in and obviously getting patients out. You know, there is a huge amount of wealth and resources available in Egypt, in Jordan, and even to more limited scale in the West Bank, and providing prosthetic care for injured and for needy patients. The inability of patients to get out. We have dozens of amputees right now who we've arranged treatment for, who are waiting to get out of Gaza, who simply aren't able to get out, obviously, because of the Israeli restrictions. And therefore, that makes huge challenges right now. In the long term, you know, we already talked about, no one knows what the long term is going to look like in Gaza. But for now, it's just an access issue from my perspective.
Thank you. Thank you, Steve. Entesar, do you want to share a little bit, but from your perspective, dealing in other circumstances like Syria?
Yeah. Okay. Maybe if I would like maybe to talk, shall I talk about challenges if it is or okay, yes. When it comes to us, because we are our main working is with people who are lost their limbs. So we try to do an action from the first time the war started. But as we all know that no one expected that it will take that long. So we started to think a lot that is it possible to bring patients from Gaza to Jordan and do the complete process? Because again, I will start from where Dr. Abdul Karim finished, and everybody maybe share with me that prosthetics, it's not only something that we can buy it from the shelf. it's a complete process, starting from the surgeon, ending with the patient, and we have to involve everybody in this. So if it is for us, we can categorize these challenges as in 3 points, maybe political first, technical and logistic. Political, something we cannot overcome. There is some reasons from Israeli side. There is some reasons from the countries where the patients will come, like Jordan or any other countries. And these things, I think we are not able to overcome. But from technical side and logistic side, I think that maybe all of us mentioned that now the situation in Gaza regarding prosthesis is not possible. There's no infrastructure. Infrastructure is demolished there. And also there's as what Steve said, that there's a shortage in materials and components. And this is also come with logistic challenges, that not everything we are able to get it. If we are thinking, for example, if we solve the issues, some technical issues, we are not able to get these components and material get in to Gaza. This is also not one of the challenges. So I think one of my maybe solution also to work on the capacity, human capacity that it's inside Gaza, to use them to help us. Maybe I'm thinking that, okay, we have CPOs, we have the people who are doing prosthesis, we have physiotherapists who are able to train some people inside. So now you have 11 CPOs, maybe the number, maybe we can increase it. It's a training, we can do a training, maybe they can do that, and we can do some support online, and then we could collaborate, all of us, to help the people to get their prosthesis, because by the end of the day, the kids need to move. It's not only moving, it's not only walking. The walking, it's not just walk, it's an experience, how to experience the world. And as what Dr. Abdelkarim said, that also we have a lot of people who are get upper limbs amputation. This is also another problem. So I think it's, if I would like to say, it's a short-term and long-term solution to work more on the people inside Gaza, to support them with many information about how to do it in good way. The other things, to have a solution or to solve the problem, that to get these material, not material, at least components, because people in Gaza can do it. Even we have a shortage in material, sometimes they can manage it, find a way to do the prosthetic socket there. However, how to get the components, the right component? We need the foot, we need the artificial foot, we need the shaft. So these things, if we have any let me say any way to solve it and to get these things go in, then we could be on a positive side. Maybe Ons was talking about maybe the negative side. Still would like to have the positive side. There's a solution. There's a challenge. Whenever there's a challenge, we have to have a solution. Yeah.
Thank you very much. Ons, do you want to jump in here as well?
So one of the challenges that I see, I'm glad you mentioned a lot of the challenges and trying to find solution, and I'm pro finding solutions, if it's possible. The challenge of people with multiple amputations. This is, I think I'm not sure how accurate this number now, but a few months ago it was 20% have at least more than one limb amputated. There was a famous case that Dr. Abdelrahman actually talked about, that he did the surgery. It's a six-year-old boy, and he did the surgery and he amputated all 4 limbs. What solution can we provide for these patients? Because always they have one healthy limb and one prosthetic, and one side supports the other. But when you need both or all 4 or 3 of them are prosthetics. These are challenges, and it would be great if our really smart engineers out there can find solutions for them or ideas to help them.
Yeah, shall I,
Yeah.
let me just stop. Yeah, one of my, our patients in my clinic that, yeah, he's a four-limb amputated and he's doing great. Really, he's doing great. It was maybe a medical fault, what has done. It's not a matter of doing prosthesis. I'm always telling this to my patients. Not the prosthesis is not moving you. You are the one who moving the prosthesis. So there is a lot of working on psychology. It's not engineering. It's something that, yes, they can do it with some even with the basic prosthesis, they can move. Now he's playing football with his prosthesis. He go to the school. He doing everything. But the main things that in this guy, that he has a very good support from his mom. So she's amazing. So it's not a big problem. It's a big problem to have four-limb amputated, but we have a solution. They because those patients have their way to cope with their problem.
Yeah.
So by the end of the day, even with the basic solutions, we can do it.
Yeah.
Yeah.
Thank you very much. I want to hit on Dr. Shehan because I think, thank you for sharing, Entesar. This is, four is just, it's even hard to imagine, you know. But Dr. Shehan, you had mentioned when we had a discussion, and Steve as well, about tracking the need. And I want to bring this up in part of the challenge of like trying to figure out where these people are. Do you want to share your thoughts? Because we went back and forth a little bit. I'd like for you to share that with the audience, if you don't mind.
Sure. So one of the things we've been doing at Imperial for the last 5 years is trying to work out how do you understand the scale of a post-conflict or a peri-conflict country's healthcare needs. So, you know, as we're all aware, in these kind of environments, having health records that are coherent is very difficult. They're often very disrupted. The hospitals are, you know, destroyed, and as we've seen in Gaza, there's no real healthcare system at the moment, so you can track patients. So one of the things we've been thinking about in other environments, for example, Ukraine, is having patient health records and patients interacting directly with us via digital platforms, so we can understand where they are, what their healthcare needs are, and build up a bigger picture of that. And clearly, and I was just very interested when I said about, you know, trying to scale this problem, trying to think for innovative solutions, because that's another way of pushing information and even kind of rehabilitation to patients virtually. And I kind of wonder, given, you know, the huge challenges facing Gaza in terms of just for physical challenges, as well as the scale, as well as the other challenges, you know, whether when you're thinking about other potential innovative solutions. I mean, I'll say one thing about the multiple limb amputees, so it's a real problem. I mean, I think we have to be pragmatic here, and I think we have to be dealing with, you know, the kind of existing technologies to do as much for as many as possible. And it's great to hear, you know, what can be done for four-limb amputee with just, you know, normal prosthetic rehabilitation, as I was saying. But I think at some stage there are other solutions that can be brought in of a higher technological complexity. But I think our initial focus should be not to be distracted by those kind of more sophisticated means, and think about just getting some really simple basic things in, and then increase sophistication as time and environment permits.
Yeah, thank you for sharing that. That's amazing. Steve, do you want to jump in here at all to share about tracking and kind of what you guys are doing? Because I think you had mentioned that as well.
Yeah, I mean, obviously, I think it's critical to keep good files and good tracking records and information on all of the patients that we're treating. They all require long-term care, and I would just like to congratulate everybody who's involved in this work. I've been working in Gaza since the first Intifada. I remember back in 1991, I brought the first child out of Gaza for treatment to the Shriners Hospital in Los Angeles. He was a triple amputee. He's doing fine. He has 3 kids. I mean, he's doing fine in the sense that he's mobile. He's still wearing prosthetics. He's in his mid-40s now. Unfortunately, he's in Han Yunis and you know, just had a baby and trying to survive. But I think the story is if you stay with these patients and you stay with these people for the long term, you track them, you give them continuous support, as I mentioned before, not just the upgrading and repairs and support for prosthetic care, but also a holistic approach to getting them education, providing them mental health support, really taking responsibility for the lives of these children. And that's what we're trying to do in Heal Palestine, is not just get them treatment, but take that responsibility so these amputees will have opportunities in their life to be independent, to have a living, to get education, to be able to care for themselves and not be dependent on a government or an NGO or family members to feed them, clothe them, and care for them. That's really our long-term goal. And I think the only way you can do that is really staying involved with them, keeping good records on their care, on their progress, and taking the responsibility and organizing the community abroad to be involved in a holistic way to support these children. That's what we're trying to accomplish. And I think as what we heard before, this isn't a one-man show. This is something that all organizations, hopefully these kind of conferences, and I appreciate you putting this together and organizing it, coming together and working together. What we've seen before is organizations not really kind of working in silos. And I think that's very unhealthy, obviously. And that's something that we need to do better. We need to show our brothers and sisters in Gaza that we're unified, we're working together, we're sharing resources, we're sharing information. And one of the best ways to do that is just keep our patients, all of these children who are suffering these traumatic amputations, and many of them, as we've heard already, even all 4 limbs, let's support them. So for the long term, we can ensure that their lives have meaning and have purpose, and they're not just occupying space and not having opportunities to lead whatever fulfilling lives that we could possibly give them. And that's something that I think, with this responsibility that we're taking upon our shoulders, all of us as organizations, as humanitarians, we can help rebuild not just the lives of these children physically, but also give them a future and show the world that, that we're here to serve Gaza, to serve Palestine in a much more effective way that's not been done before in the past.
Yeah, no, absolutely. Thank you for sharing that. I want to give a few moments, but I forget there's a young lady in the room who focuses on psychosocial. We invited her. Is it Gaza? Yes. And can you come up for a minute just to share for 2 or 3 minutes, just 2 minutes maybe. Can you share some ideas you have on psychosocial, what you've seen? What are some things that as NGOs that we can think about? We'd love to get some of your perspective.
Good evening. My name is Ghada. It has been 15 years since I was a little one that studied prosthetic and orthotic in the University of Jordan. And then I work with the people, with the amputee people for 15 years. In this long journey, something in my mind said that these people need more than a prosthesis. There is something between the lines. Their eyes told me that we don't need this prosthesis at all. We need another thing. We need someone to hear us. We have a story. So I tried to do something. I studied counseling, and my counseling journey, I make it for the disabled people, especially the prosthetic users. I work with Entesar. Thank you, Jason and Entesar, for inviting me today. My opinion, for people in Gaza, first of all, أكتر إشي, the most thing we think about the human in himself. There's a lot of people, there's, okay. لا أنا okay. عشان you got emotional. Okay. في أشياء كتير بتطلع في راسي. أحكيها بالعربي. أوكي أحسن. عشان أنا بحس دائما عشان الإرشاد بخلي أنا بحسه إشي بيعبر بالعربي بلغة البني آدم. فأنا اللي بحكيه إنه هدول الناس قبل ما نحكي التشالنجينج والأشياء نفكر فيهم هم كأشخاص، لأنه ممكن إحنا ندخل كومبوننت ونطلعهم برا غزة ونجيبهم على عمان ونوديهم على أمريكا، بس هو ما بده يلبس هذا الطرف، لأنه هو في أشياء كتير. أهم إشي أحكي بهاي، بس هو فصل صح؟ أوكي. كنت بدي أحكي إنه أصلاً البتر ذات نفسه الأمبيوتيشن هو حدث ضاغط، حدث موتر. فأنا لما صارت أحداث غزة كنت بفكر بالناس اللي هناك إنه هو مش بس تعرض للأمبيوتيشن، هو في أشياء صارت قبل وأثناء وبعد الأمبيوتيشن اتسلف. يعني هو يمكن الأمبيوتيشن والحادث اللي فقد فيها إيده أو رجله مش هي الإشي اللي زعجته، أو مش هو الإشي اللي متعبه. ممكن هو يفقد رجله، فقد كتير ناس من عيلته في نفس اللحظة، فهو بالميموري تبعته آخر همه يستلم هذا الطرف أو ياخذ طرف أو هذا. أنا فكرتي لأهل غزة أول إشي خصوصا اللي بدهم يركبوا أطراف، نشتغل معهم mental health. أهم إشي أشوفه هو على التقبل، إنه إذا بده يلبس هذا الطرف أو لا، وأنا أشتغل معه يتقبل اللي صار. هلا أنا عارف إنه هلا فيش كتير بدائل، وهم كتير شايفين الحياة فيش فيها بدائل، بس برضه يمكن يكون الطرف هو بديل عشان يرجع لهاي الحياة تبعته. أنا كتير بحكي.
لا شكرا. I think it's important because Dr. Ghassan Abou-Sitti, he emphasized that, you know, the psychosocial is just critical. And I think if we don't add that into the mix, we're missing a huge part of this. And so with the few minutes we have left, I do want to give time to Tony, who's our partner with Bionic, for him to shine and to share kind of what are some things they've learned there in the US. So Tony, I'm going to pass it to you to share about the 3D solution that you guys have utilized for a while.
Hey, great. Everyone hear me okay? I'm going to share a video kind of a digital overlook of the solution, and then kind of talk over it and try and hit on some points that were brought up by all the other panelists as well. Can you guys enable me to screen share? But many of the points that were brought up from the panelists is access to care, and additionally issues with not having enough trained prosthetists, orthotists, technicians to be able to handle the volume of care, and additionally create opportunity for patients to be seen in multiple environments. Share this. Can everyone see my screen now? So with the implementation of 3D printing into our clinics, what it's allowed us to do is bring access to care and speed up care to individuals across our company. Implementing a digital solution and digital workflow in the prosthetic scope is not an easy process, especially for many of the prosthetists and orthotists that are trained in more of a traditional fabrication manner. But in the US, one of the challenges we've seen in our healthcare system is the need to have our prosthetists and orthotists spend more time with a patient and less time in a laboratory setting, fabricating devices, making adjustments to devices. And the reason for that is our healthcare system is changing to more of an outcomes-based healthcare system. So what that means is we need our patients to set goals, need them to achieve those goals. We need to work with them on the mental health aspect. We need to serve as guiders of their care and implement them with multiple people across the rehab realm, including physiotherapists, occupational therapists, surgeons, physical medicine, rehabilitation doctors, sometimes community groups to get the services they need. And that's really where the care paradigm is shifting in the US. So by our group really focusing on how can we create excellent, sustainable solutions for our patients, and enable our practitioners to become more patient-centric as opposed to device-centric. What would it look like for our group, and what would it do for our patient care population? And especially thinking about the challenges of the lack of number of trained CPOs in that area. I think one of the panelists said there's 11 in a certain area to service an entire population. That's a challenge that we do face in the US as well, is the prosthetist orthotist population is aging, and there's not as many new prosthetist orthotists coming in. So by building and creating a digital workflow, we're able to have one or two centralized digital technicians and prosthetists that can help service a volume of patients. Now I know that your guys' group just received a printer. We have 5 of those such printers, and we're able to service over 300 prosthetic devices per month with that. And that takes significant amount of time. It gives a significant amount of time back to our prosthetist orthotist clinicians, because they don't need to be the ones that are physically fabricating these devices. They could focus on implementing that care. They could focus on working with the physiotherapist to help those amputees get the best outcomes. One of the things that we're really proud of is some of our partnerships we've developed with the printer manufacturers and material manufacturers to continually try and find a solution that can be utilized in the long term. Some of the people on here familiar with prosthetic and orthotic care, the process of building a prosthesis can be very time consuming and expensive with the materials that we have to utilize. However, with this printing filaments that we use, specifically, we've developed one that's built out of a co-poly based plastic that has integration of carbon fiber into the filament with Mitsubishi Chemical. And what we're seeing in the US is, you see the gentleman on the bottom right here of this video, we're able to rapidly produce a prosthesis. This gentleman came into my clinic at 9 a.m. We did a digital scan of his limb, did a digital modification, printed his prostheses, and had him up and walking that afternoon. And the material cost for that is low. It's that being done traditionally would be several hundreds, close to thousands of US dollars to fabricate those parts of the prosthesis. But the amount of time and material we can save in the printing application, we reduce a lot of waste, and we make it much more cost effective, where maybe total material cost for those specific prostheses is right around $100 US dollars.
Can you do us a favor? Because I think there's a lot of people in this room that maybe aren't as technically savvy as you. So at a 10,000 foot level, can you walk us through the steps from scanning from an iPhone to production to printing, high level overview, if you don't mind?
Great. Yeah, that's why I wanted to put this process together in this video, to kind of show everyone what it does look like. So when we can evaluate a patient in the clinic and determine what their specific needs are for a prosthesis, the utilization of digital technology, in particular iPhone-based scanning, we can capture a very accurate three-dimensional model of their limb that tells the story of their limb at that point in time, and what the need for the prosthetic care is going to have to be. Then with that scanning solution, we can port it over into another development and design program where our prosthetists can utilize the same principles they would utilize with plaster modifications in this digital landscape, and create that prosthesis that can support their body weight and enable them to be more mobile, comfortable. Then the third step in the process is we utilize another program that is very similar to a CAD CAM engineering style program to build the physical shape of the prosthesis. So we create a digital model of exactly what we're going to tell our printer to do. So we design all the intricacies that need to be there. We design the structural safety and the thickness requirements for that level of activity. And then that digital model, which is in the third screen, the top right screen, then gets ported over to our 3D printer, which is just essentially a tool that's going to do exactly what we tell it to do. And the 3D printers that we're utilizing and that you guys have there with 3D P4Me is able to rapidly produce a 3D printed diagnostic socket or a 3D printed long-term socket in an hour to 2 hours, with very little material wastage and very easy post-processing and able to get it from the printer onto the patient, you know, in such a short time frame. And then this fourth video that we're seeing right now is, you know, kind of some of the parts that the representative from Ottobock have been talking about, the pipe that leads to the foot, the multiple components that are necessary to make a prosthesis usable, and someone be ambulatory with it. That's kind of the assembly of it. Getting that taken care of. So if we look at this process, you know, especially from a time perspective, scanning of a patient is going to take about a minute or so, 2 minutes. To get from digital modification and prosthetic shape design, that's probably about a 10 to 15 minute process. Printing is about an hour and a half. Assembly is about 10 minutes, and then we can get the patient up and walking in such a short time frame. You know,
Let me just jump in here, Tony. Thank you for the summary. Just to kind of give you a high level overview, is that me or is that just let me a little farther? High level overview is you can take your iPhone, you can scan it on the residual limb. That goes right to the cloud. From the cloud, you can 3D print the socket. With the socket, you assemble all the parts, and then it's with the CPO, they have to make sure, this is where Entesar comes in, and her team, they have to make sure that the person can walk and that they can balance accordingly. But everything's there. It's been doing, they're doing it in Ukraine right now. So it's a rinse and repeat opportunity where we're not recreating the wheel, but we're just adding value to the ecosystem that's already here. So thank you, Tony. Thank you for sharing. I want to move on right now. Go ahead, Kosai. Yeah, question.
Thank you.
You want to introduce yourself?
Yeah, my name is Qusay Marahme. I was one of a great team. We work with MSF and FabLab Irbit long time ago. We start with prosthetics, but upper limb, not lower limb. We do a couple of sockets, but the main challenge for us, especially what I understand, we focus on children. So we all know the children grow very fast. So each like 6 months, you have to change the socket or the. So if we do this thing with, especially with Gaza, it will be a really big challenge, especially with the logistics side. So I think if we cannot have access, especially with FDM printers or SLA, there is a lot of troubleshooting. So you have like 3-4 models until you have the high-end products, let's call it. So there's a tolerance. Maybe I was handling the technical side. So before, like 10 years ago, it was the very limitation with the filaments. Now we have a material science. It's became more improved. Before, like ABS or PLA. And if you have bad weather, cold weather, the dimensions will change. So you have to repeat all the thing. So that's, I think, the main thing we should focus on. When we have the digital file, it's easy when we scan it. After 1 year, you just 2 click, you scale up, and that's it. But the change when you have the real dimensions. And I have a concern also that iPhone scan is not that accurate. Yeah.
We do have
I
we
could
do have
comment
Shining 3D
on that
scanner,
as
which
well.
higher grade. But I thank you, Kosai. I think what we're doing in Ukraine, what our partners are doing in Ukraine from an iPhone, it's the initial mesh, and then you can upgrade it with a specialist. But I want to open it up because I think Steve has to leave at the top of the hour, which we want to respect his time. But I want to open it up for Q&A because I think there's a lot of questions out there and some dialogue. I think we've shared a lot of good things. But I want to open it up to you guys if there's any burning questions on your mind you want to ask. Not everybody at once. Maybe I'll ask a question first for maybe Dr. Shehan. In terms of your experience already in Gaza and the teams that you guys have sent, what are the solutions you've done in the past, and how long would it take to rebuild those, like in an ideal setting?
Do you mean from a prosthetic perspective or surgical perspective or?
From a prosthetics perspective.
So, okay, so from a UK Med perspective, which is the UK NGO that's delivering care currently into Gaza via 2 or 4 hospitals, we've not done prosthetics as a delivery before. However, that's kind of, where we come to kind of this partnership, because, obviously we have a field hospital in place there, giving both primary and secondary care. So, that's, I think there's an opportunity for collaboration there, because, basically got, a field hospital, the infrastructure to link the surgical mission to a prosthetic mission. So from our perspective, we're kind of not a prosthetic provider.
Okay, no, sorry about that. I misunderstood. Steve, do you want to share, like, how much time do you think in an ideal world to set up a facility to be fully functional inside of Gaza in an ideal world,
In an ideal world, it wouldn't take much. I think the resources are certainly available. There's good qualified people on the ground in Gaza. There's certainly a huge amount of goodwill and people ready to come in and assist from outside. In an ideal world where we didn't have massacres occurring, which is happening in Nusrat camp now, and which there's a closure and embargo on Gaza, and which is affecting all aspects of life there. If that's taken away and Gaza's open and we can rebuild, and there's a freedom to rebuild, the resources are there, the manpower is there, the expertise is there, both internally and externally. I think it would not take much to get things started and getting these children and patients into proper treatment plans. But unfortunately, that we're not living in an ideal world. We have to deal with the current circumstances, which are extremely prohibitive to even start this program. I think we can start, and we should start, and certainly start planning. And that should be the focus of these discussions, is when we're able to launch and ready to start, what's the next step? We're certainly ready to be part of that. And I think the number of people who came out today and the quality of people on your panel and who've spoken already is pretty high, and it indicates that it won't take much to get a program started there. So I'm optimistic, but unfortunately the reality is, under this current situation and with the current international lack of support for the Palestinians, particularly from my government here in the United States, but all over the world, the people are here to support. We stand with our brothers and sisters in Gaza, but unfortunately our governments are making it very difficult to provide the kind of aid and support necessary to heal the lives of these poor innocent children. We're ready. I think everybody's ready, and it won't take much, but unfortunately we do not live in an ideal world.
Do you want to jump in with any thoughts here in terms of, from your perspective?
So I agree with Steve. Today, it's very challenging, but once there's a ceasefire or accessibility improve, there is a potential, and there are a lot of great doctors inside Gaza. We are running a huge operation with 900 staff. 95% of them are locals. They're incredible. They're incredible mental health specialists. So they are there. It just putting all the pieces together. Again, International Medical Corps is operating both in Rafah and Deir al-Balah. We are pro-partnership. We're already working very close with PCRF and other organizations on the ground. We're referring cases. We're sharing supplies and equipment as needed. We're helping each other as much as possible. So we welcome any opportunity to partner and help people inside Gaza.
Yes, trying to not to repeat the previous points. I think I agree with everybody that said access is the main problem. Whether it's access of getting the patients outside for immediate treatment, or getting whatever equipment or material or personnel or teams inside Gaza. And from from knowing what was happening before the war and now, I think a 3D printer with raw materials going inside Gaza is much harder than getting a fabricated prosthesis, because they are afraid of something they call dual use, which is basically anything that can be altered no matter what to make something else. And this is even before the war, this was very hard to get in. And after what happened, I think this is going to be a very big problem. I want to point out to something that even though we are unable to do a big change on the ground immediately by sending personnel or equipment, I think advocacy is very important. And our meeting today and our coming together of all these organizations and international people, we have to raise the problem, we have to raise awareness, and we have to advocate. And we have to advocate for access for medical treatment. And we have to advocate for access to prosthetics. And it goes both ways. I think a humanitarian corridor, whether through the West Bank to Jordan, where both can cooperate on this, is extremely important. I think, as everybody said, we have a big capacity and a lot of people are willing to cooperate. I don't think our shortage is going to be either money or people who are willing to volunteer or work. I think our main problem is access. And even if we are unable to shift equipment or personnel at the moment, I think we should advocate for that. And advocating for this, every one of us, I think we can maybe move the issue a little closer to reality, because that's the main issue. And that's where the moment we tackle this, I think everybody can cooperate and we can make a big change on the ground, even within weeks or months. We don't need to wait years, because a lot of people are there. We have the capacity. It's just the logistics are hard.
Thank you, Doctor. Just to clarify too, we don't imagine ourselves bringing in a 3D printer in Gaza, but we can scan in Gaza. Everything goes to the Amazon cloud, and then we can print it here and ship it back in with that customized fitting. Would you like to say something, Entesar?
It's something to always we say that war will finish today, tomorrow, we don't know. It's again, I would like to emphasize on something to build the team. It's a collaborative issues, not only sending prostheses. It's not only sending prostheses. It's also, we need, as what Ghada mentioned, we need a psychological support. We need a rehab team who's taking care about changes of the stump. It's not only growing, the patient will grow or the kids will grow. We have a problem sometimes that the stump is changing after fitting. So how we have to overcome all of these things, if we building a team there, a good team there, and we have a good team here, I think it will be, we will have much more better results. That's all. Thanks.
I want to open it up for any last minute questions, and then I might close this. Josiah. There's a few online. Okay, let's go to the online questions if we want to go to one.
Some people are asking about the affordability of these kinds of prosthetics. Like, can people afford them? Are they expensive?
Tony, do you want to share about this, the affordability side from your perspective?
So the utilization of FDM printing at additive manufacturing and prosthetic care really does cut down the cost of prostheses, especially in missions like this, where it's heavily volunteer based. We're eliminating time from physical processes, and the material cost of manufacturing one of these prostheses is probably 10 to 20% that of traditional manufacturing. So I'm not really sure how the patient care system works in Gaza.
We have to add customs, so that makes it a little more expensive here.
Right. So yeah, but I guess the answer to the question is, by utilizing the printing process, we can really heavily control the manufacturing costs, so that if we can limit that, we can definitely limit the amount of cost that gets passed on to the patient or the end user. And another benefit of the digital workflow is we already have their limb shape and model within the cloud. So if something changes, or if they grow, or if they shrink rapidly, we can rapidly produce that next version of a prosthesis without necessarily having to have multiple clinical care visits.
Well, I think for the sake of time and just to honor everyone, I want to give all the panelists a chance to share their final thoughts. And then I might close this out, if that's okay. Unless there's any last minute burning questions out there. Any burning questions? Yeah, go ahead. Can you, so that everybody can hear online?
I'm just wondering, are there any obvious NGOs, CBOs, local civil society that you've identified that you could work with as you're مثل ما تفضلتي you can start training practitioners or maybe even at the like physiotherapy level. Are there any clear civil society actors that you've been able to identify to do that work with?
I think for us, and I can't speak for the panel, but I think for us, we're trying to identify who wants to work and how do we build like a best practices so that people can share. Go ahead.
Yes, we have been in contact with the people on the ground. So I'm not sure if you know about the politics. Basically, we are the West Bank and Gaza, but we are one society. So the society in the West Bank and Gaza, they have been knowing each other, even though they don't have the physical access. And they have been working together, whether online or communicating. At the moment, as I said before, we have 11 specialists at the moment inside Gaza living in tents and 14 technicians. In the West Bank, the capacity is way more than that. But we also have a university that has a 4-year program for specialists in prosthetics in the West Bank. And we have the one factory, we have 8 workshops. And of course, other countries who are willing to help are gonna come to this. And we know the head, not the official head, we don't have an official head, but we know the most senior specialist in Gaza. And we've been talking to him about what we can do and what we can do on the ground. And it is not a problem of organizing at the moment. It's the problem that they are standing in tents helpless. They have no access to any equipment to do anything.
Why don't Ons go ahead?
So working with local partner is one of the main pillars of the way International Medical Corps works. So we've been working for several years, since 2008, with multiple local CBOs and NGOs in Gaza. And today they're helping us a lot with mobilizing local volunteers and identifying cases of malnutrition and cases that needs referral. So there is capacity and there are local NGOs, but again, we need the pieces to take it to the next step.
Well, for the sake of time, because I think I'm hungry and I think everybody else is hungry and we got a lot of good food coming. But let's just, Dr. Shehan, maybe we'll start with you and then Tony and then come to the panelists here. Last thoughts, closing thoughts, anything you want to leave us with, inspiration. Yeah, the floor is yours, Doctor.
Thank you. So just to express my thanks for being part of this, but I think I'll go back to one of the points I made earlier on that, I think there's a lot of expertise both in the room and online and globally. And it's really how we cohere out the most effective way to do a solution for whenever the situation in Gaza becomes more permissive. So I think building collaborations like this is the key, because whatever problems we encounter either now or in the future, the collaboration like this will provide a solution. Thank you.
Tony, go ahead.
Really want to echo what Dr. Shehan just said. The world is small and it's getting smaller, and the utilization of a digital platform doesn't only give you access to local experts, but it gives you access to international experts to help support, whatever you want to do. And we've seen that in our printing program. We've seen the efficiencies that it can bring to prosthetic care and patient care and mobility. So really, really excited about this collaboration.
Thank you, Dr. Tony.
Yes, my final thought is that we should have more meetings like this. This is very important. What we have done today, having the exchange of ideas is the first step. If we don't have the exchange of ideas and the networking, we will be just one person on each. We cannot do anything. And I think even if we don't find the perfect solution by the end of this meeting, I think having more meetings like this will end up with doing something. So thank you everybody for coming.
I agree with Dr. AbdelRahman. Thanks, Jason, for bringing us together. And I'm honored to have met so many great people. And I'm not pessimistic, but I think once the situation gets a little bit better and with more access, everybody will be ready to work together. And we're always there. We're open to any partnership in any way, shape, or form to help people in Gaza.
My keyword is collaboration, cooperation together. For sure, we will have a solution. Our mission in my company is always be saying it's the power of next. Yeah, challenge is there, but there is with the challenges we will have empower in powerful solutions. And I think this meeting the first step to start like this. Thanks, Jason.
Thank you. Dr. AbdelRahman, we get a text. Oh, no, it went away. Can you just 1 second? We get a text. I think it's meaningful if you don't mind reading it from one of the users. Yeah, Josiah will come and open his phone. If you can read that for the audience.
Yes, actually, this is the person we tried to get a video message from. His name is Ahmed Al-Absi, head of the prosthetic orthotic department, Hamad Hospital in Gaza. We tried for the last 2 days to get a video message from him. And because of the internet connection, he wasn't able to send us a video message, but he sent us a text message. And it says as following: because of the internet problem, please pass on a message of thanks to everyone for their support, especially on the issue of prosthetic limbs due to the difficult situation. We are waiting for the opportunity to return to work at Hamad Hospital and everyone's cooperation with us. Thank you very much.
Thank you. I think I just feel so honored to be here today and just to listen to you guys and to Steve, who's not with us. And I think I can echo your thoughts of, how do we take this? And I think Dr. Shehan mentioned before, is like, it might be hard to collaborate with everyone because it's just a lot of complexity, but how do we build best practices? Are there certain things that we can share, that we can learn from each other and grow? And I think that's our heart. We're a small NGO, but how do we bring value into the space? And so I just want to thank you all for being here. We appreciate your support. We appreciate you attending. And I'm really excited for the future. I think that the opportunities are endless, but we have to start somewhere. And I hope that today can be a spark to that end. So thank you guys.